We learned today that the patient was in a hallway at the Health Sciences Centre Emergency Department. Dr. Shawn Young, the Chief Operating Officer at Health Sciences Centre, answered some questions this afternoon. He says this patient arrived at the emergency department by ambulance just after 11:30 Monday night and was assessed and triaged. About an hour later, he says, staff became aware that the patient's condition worsened. He says medical interventions took place, but the patient died.
The details of the patient's time in our emergency department are subject to a critical incident investigation. This is both to identify areas where we could have done something differently, but also to identify lessons that we can implement to ensure this does not happen again.
Young says staffing was at or nearly at baseline that night. The head of the nurses union says many of the nurses were working overtime and that this is a result of a critical nursing shortage in the department.
When you are not able to keep eyes on patients in your waiting room, when you are not able to get out and actually see those patients and assess them from a nursing perspective, then, unfortunately, this is a perfect example of a failure in the system.
Young says they were busy that night and were seeing double the amount of the highest acuity patients.
That we are still struggling with staffing throughout the site, which is really impairing our ability to get admitted patients into the facility. So being able to address the staffing challenges in particular is one of the biggest areas of work that we need to really put all our efforts into.
He says healthcare aides do check on patients who are waiting fairly regularly, but he couldn't say if one was there at the time. He says the person who died did not have any family with them, but he would not provide any other details, citing patient privacy laws. Alana Cole, CBC News, Winnipeg.